This is Dr. Oza, obstetrician and gynecologist, bringing you greetings from Dr. Oza's Hospital, Panvel, Maharashtra, Navi Mumbai, India. Let us talk today about how to find out the correct EDD and why it is so important to have accurate dating of pregnancy. When a lady conceives, she goes to her obstetrician. The obstetrician gives her an expected due date, that is EDD, calculated from the last menstrual period, first day of the last menstrual period. When she goes for ultrasound scan, the sonography doctor gives her another EDD which may be different. This lady, when goes for subsequent sonography scans, the scans may mention an EDD which may be altogether different from previously given EDDs. Ultimately, she gets confused as to which is her correct EDD and when she is going to deliver. So friends, let us talk about this puzzle today and let us find out some solutions and clear our doubts. For simplicity, let us consider 4 different groups. First, a lady who was having previously regular menstrual cycles of 28 days. This is the most suitable case for her calculating LMP derived EDD. Take her LMP, add 280 days to it, you get the EDD. You have an option of reconfirming it when a sonography scan is performed between 6 and 14 weeks and given an EDD. If the EDD from LMP differs from EDD from sonography, if the difference is by more than 5 days, then sonography given EDD is upheld. Otherwise, LMP derived EDD is confirmed and assigned. Now let's take second group. A patient who was having previously irregular cycles or she is not sure of her LMP altogether. This lady is the most suitable candidate for assigning sonography derived EDD. Sonography scan performed between 6 and 9 weeks takes into consideration the maximum length of the embryo, like this. The maximum length of the embryo is measured and then EDD is given. When the patient undergoes a scan between 9 and 14 weeks, the crown rump length is measured. That means the distance from the top of the fetal head to the bottom of the fetal spine. That is called as crown rump length. Like this. This should be the ideal scan or the ideal profile to see the CRL. An accurately measured CRL between 9 and 14 weeks is a very good guide to give an EDD. So friends, in this group number 2, where the cycles were irregular or where the patient is not sure of her EDD, sonography derived EDD is assigned. Now let us take group number 3. A lady who has conceived via test tube baby or IVF. The patient always remembers the date of embryo transfer, that is ET. For a fresh egg IVF, take ET, add 266 days, that is your EDD. For a frozen embryo transfer case, take ET, add 266 minus age of embryo. So suppose day 3 embryo has been transferred, take ET, add 266 minus 3, that is your EDD. Suppose day 5 blastocyst has been transferred, take ET, add 266 minus 5, that will be your EDD. Now fourth group. A patient who is having multifetal pregnancy, say twins pregnancy, and the measurement of both the fetuses are different. Now, the EDD should be calculated as per the bigger size fetus, and that EDD should be assigned. Now, the most important question arises: having fixed an EDD, when the lady goes for subsequent scans, sonography scans, in the second or third trimester, and the report mentions a different EDD, what to do now? So friends, my sincere advice is never change an EDD once it is properly assigned either by LMP or by 6 to 14 weeks sonography scan, which are the most important assignment of the as far as EDD is concerned. So never change the EDD. Now, another question. Why this accurate dating of a pregnancy is so important? Number one, to plan the necessary tests and the timing of the tests, like blood test, double marker, quadruple marker test, or sonography scans, most important being anti-scan or anomaly scan and anomaly scan. Number two, timing of administrating the drugs like steroids for enhancing pulmonary lung maturity or giving injection NTD at 28 weeks in a case of RS negative mother. Number three, to monitor the fetal growth in certain conditions like fetal growth restriction, pregnancy-induced hypertension, gestational diabetes mellitus. Number four, correct timing of the delivery of the baby. In high-risk cases, especially, it is very important. Namely, preeclampsia, high-risk pregnancy like preeclampsia, gestational diabetes mellitus, fetal growth restriction, bad obstetric history in the form of previous pregnancy stillbirth. Number five, when you are delivering a baby and in a high-risk case, it is most important to know what is the gestational age of the fetus and what is the expected fetal weight so that the proper neonatal care can be planned accordingly. Now, last question. A patient thinks, I have been assigned an EDD. Will I deliver on the same day or no? Friends, 10% of the cases will deliver exactly on the EDD. 80% may deliver little before the EDD and 10% may deliver after EDD. So who are the ladies who are likely to deliver before EDD? A patient in her previous pregnancy who had delivered before EDD is likely to deliver before EDD. The cause may be preterm labor, that means the pain started early, or premature rupture of membranes, that means the water broke or leaking started early, or incompetent cervix where the mouth of the womb is not strong enough to hold the pregnancy for long. Whatever may be the cause, the history may repeat in this pregnancy. Number two, the obstetric conditions like twins, excessive amount of fluid that is called as polyhydramnios, preeclampsia, gestational diabetes mellitus, or placenta previa. These cases are again likely to deliver before EDD. Next group, if the patient had been consuming tobacco in any form or alcohol, or if the patient has been consuming excessive amount of coffee, she is likely to deliver before dates. Now, who are the ladies who are likely to deliver after EDD? If the patient has delivered after EDD in her prior pregnancy, or if the patient is a primigravida, means pregnant for the first time, or if the patient is obese, that is having BMI more than 30. These are the ladies who are likely to deliver after the EDD is crossed. So friends, the take-home message of this video would be, once an EDD is accurately assigned, never change the EDD throughout the pregnancy. I hope this video has cleared most of the doubts in this aspect of the pregnancy and it was useful to you. This similar video is also available in Hindi language. Thanks for your kind listening. Thank you.